Hello, everyone. We are live with this amazing summit about the autoimmunity and chronic pain. Hopefully, you can join us, ask your questions. We are with Dr. Anshul Gupta, Heather Gray, Dr. Miles Nichols, and Dr. Lauren and Cholin Moy. Be with us till the end. All right. So today's day theme is Hashimoto's, fibromyalgia, Lyme, and celiac. We have Choling Moy. She's a bestseller author, alternative and Chinese medicine expert. We have Heather Gray. She's functional nutrition practitioner and Lyme boss. Dr. Anshul Gupta. She's medical doctor, best-selling author, speaker, researcher, and world expert in Hashimoto's disease. We have Dr. Miles Nichols, functional medicine doctor, specializing in Lyme, mold illness, gut, thyroid, and autoimmunity. We also have Dr. Lauren Lax, former TV news journalist, gun health detective, and gut love food freedom expert. So you'll see we have amazing day today. Hello everyone again. We're gonna start with everyone, even if I welcome them and introduce them, but I like them to talk about what they're doing for in one sentence. So we start from Heather.
Of course. I just love the way you say my name. It cracks me up every time. I just love your accent. But I'm Heather Gray, yes, a functional diagnostic nutrition practitioner, and I work with frustrated professionals who are sick of being sick. They're over their digestive issues, their crazy brain fog, and sick and tired of throwing Band-Aids at symptoms. My background is in Lyme, mold, and autoimmune, and I love working with the really complex cases.
Thank you so much. Now we go to Anshul, Dr. Anshul Gupta.
Thank you for having me over here. So, I'm a board certified family physician with advanced training in functional medicine. I specialize into Hashimoto's disease. So, I help people reverse their Hashimoto's by making personalized functional medicine plans.
Amazing. I love your introduction. Everything is very summarized, brief. That's what I like. And then we have Dr. Miles Nichols. That's the first time I have him here, but welcome to on my show.
Hi, everyone. Dr. Miles here, and I'm focused on helping people who are struggling with complex chronic issues. Sometimes it's a mystery. Sometimes they know they have Lyme or mold or fibromyalgia or an autoimmune issue. I tend to get the people who have been working with 5 or 6 or 7 other practitioners on their journey and still haven't figured things out. And I also have a training program for practitioners and doctors to learn about functional medicine and how to treat complex chronic illness. Thanks so much for having me.
Thank you so much, Dr. Miles. Then we have Cholin Moy. Actually, she is one of my friends, and during these days we worked together in 2 books, and I had amazing experience with her because she's full of information and resources. Welcome to my show, Cho.
Thank you so much. Okay, for that introduction, I really enjoy working with you as well, and it's great to collaborate. My name is Cholin Moy. I am an acupuncturist and Chinese medicine practitioner with a specialty in fertility. My office is located in New York City in Union Square. And I help women find better and natural ways to get pregnant so they don't have to undergo painful or invasive procedures just to have a baby. And a lot of that entails getting into what are some underlying conditions. Often we see subclinical autoimmune conditions that are playing a role in inflammation and creating problems with fertility. Excited to be here and meet everybody.
Thank you so much. And Dr. Lauren Lax.
Oh,
Sorry.
thank you. No, I was just going to say, as you mentioned in your introduction, so former TV news journalist, gone health detective, which is basically a functional medicine expert that helps individuals with unsolved health issues really get to the root cause. And my work is inspired by my 25 years of clinical and really personal experience in being diagnosed with over 10 different chronic conditions, really diets, doctors, and Dr. Google could not solve. And of that list included 5 different autoimmune diseases, mast cell activation syndrome, mold illness, Lyme disease, and a chronic eating disorder that almost actually cost me my life as well. And so I really get in the trenches with my clients and helping them not only just work through their issues that they're trying to solve, but really being able to relate to them. And you mentioned the food freedom and gut health piece there to the puzzle. So I believe the gut is the gateway to health. And so I help individuals optimize the internal. Health is an inside job to then really help mitigate and find resolution from symptomology and do a ton of work around the food freedom aspect of health, not just over eating disorders, but a lot of food intolerances and or food reservations that can be created from chronic illness as well. And then supporting the gut-brain axis and really rewiring up here to influence the external as well. And the symptomology, I believe symptoms a lot of times are metaphors for what's happening internally as well.
Thank you so much for everybody's introduction. Okay, my name is Fanta Kalhor. I'm a 6 times bestseller author. The recent book already hit the bestseller in US and Canada as well. So I actually am a founder of 8th Choice Publishing and Branding, and I'm also functional medicine practitioner. I have a really long story to be in health because I was not like health practitioner before. But seeing you guys interviewing everybody, just that was a really great journey to learn about this amazing functional medicine and holistic medicine and how it can do to our body. I just want to bring some awareness to people who are suffering from chronic pain because I had the same issue. I was a fertility warrior for 2 years, and I couldn't have my baby. That was not a good idea to go to different doctors, specialists, and with no hope. And then one day I stopped, and then I think I have to find an alternative. I know lots of people are in the same shoes as me. And we are here to discuss about chronic pain and something that we suffer for a long time, even if it's fertility, even if it's chronic pain as general, or even if it's autoimmunity. The problem is the root cause for any of these problems may be the same, right? Because I remember as a fertility consultant working with different patients, and even if they actually on one day they say, oh, we're not going to have a baby because we give up, we went to different specialists, and then they have different excuses. After years of seeing them, they have other issues. They have thyroid problem, Hashimoto's, and other issues. So in one point, if you stop treating yourself holistically, another part of your life, you will have other problems. So we try to stop it with having lifestyle changes, with having great information from these amazing people who know and already practice this with their patients. So what are we going to do? We're going to talk about your own story, right? A story that help you to be in this journey. Let's say a love hitter story, because she actually could reverse 2 out of 3 autoimmune disease, and this was for me was so interesting and so exciting to share her story in Needs Gap book. So I love to hear from you.
Oh, absolutely. Thank you. Yeah, I usually start off any talks with talking about how I was basically born constipated, right? that was my early part of my journey of sitting on the potty until my feet fell asleep because I was on there for so long. And at the time, the doctors were just throwing nasty oils down my throat and trying to soften my stool, but nobody was trying to figure out the root cause of why this 4-year-old couldn't, poop. Come to find out, my uncle had killed himself that same year as well. And so there was a lot of early childhood trauma going on that impacted my gut. And then I also found out I had celiac disease, which didn't get diagnosed with that for like 30 years later. I was undiagnosed Lyme disease for over 28 years, mold toxicities, heavy metals, celiac, Hashimoto's, endometriosis. So all the things. Couple stints in the psych ward for suicide attempts. So I've got a huge passion in this because I felt like such slipped through the cracks of Western medicine model, right? Of just kind of throwing Band-Aids at symptoms and seeing what sticks. And, something intuitively always kept driving me that there's got to be an answer. There's got to be more. Like, this can't be it. Pills can't be the answer to everything, that or surgery, right? There's got to be something more. And so I started peeling back all the layers, the trauma, the crap in my nervous system that was, keeping me in fight or flight. Diet, I was eating a traditional, sad standard American diet. That's what was keeping me sick. I was burning my candle at both ends, staying up too late. And that's, how I ended up getting better. It sounded almost too good to be true, kind of simple, but not simple at the same time, because when you go back to the beginning and you focus on the foundations, it's amazing at what the body can do when you give it the tools that it needs. And so throughout my many years in being in practice, I started putting together all the different parts and the pieces. FDN is huge on the dress for success model, right? Diet, rest, exercise, stress reduction, supplementation. And then I've also added like some bioenergetic work to kind of help move and clear some of that energetic stuff that's stored in our nervous system, the cellular memory, the trauma, without actually having to relive the trauma. So there's so many ways to go about it, but I found that focusing on the foundations is kind of like key. Don't pass go, don't collect $200. You got to kind of get those foundations down.
So if you want to see her story and her solution, you can go to Needs Gap. There are a lot of good solution and information about her. You can read more, but that's how she started with her own problems. So there are lots of hope that you can also learn from them and see how we can do about it. So let's go with Dr. Anshul Gupta. I know you are a medical doctor. So what happened to you to just started going for Hashimoto? And I actually read his book about the Hashimoto. I love his book. And that's exactly about the root causes, and is not only thyroid or just going to treat the paper, right?
Right, absolutely. So my story started, I was trained as a traditional family practice doctor. So I was in my private practice, very busy practice, but just few years into my practice, I started having a lot of issues. I was gaining this weight without even changing my diet or exercising. I was feeling tired to the point that I had to take a nap during the day into my clinic just to finish my seeing my patients. At the end of the day, I was kind of feeling that my mental capacity was down, that sometimes I'll feel confused or I will not be able to pay any more attention to things. I was having this horrible, horrible stomach pain, and I had no idea what was causing it. It was so random that even while seeing patients or while doing things, I would suddenly have this pain, and obviously I could not do anything. Thinking I'm a good doctor, so I started taking some medications that was not doing anything for me. Then I thought maybe I'm not a smart doctor, so I need to see more smart practitioners to get me better. So I saw all different specialists. They ordered all different kinds of testing, endoscopies, ultrasounds, blood work, you name it. Everything was normal. Nobody had any idea what was going on with me. So, and at the time I was only 32 years of age. So that was scary because I had no hope. I had no way out of it. That's where I found functional medicine, and then kind of, did kind of, some protocols on myself, change some lifestyle changes, did a stress management techniques on myself, started eating better, took some supplements. Within 1 month, my pain was completely gone. Within 6 months, I lost 40 pounds. I had more energy in my life than I ever had before. I even completed a 5K rugged maniac, and I was never an athlete. So for me to do that was a big issue. I had more mental clarity. I was able to reverse my eczema. My liver, fatty liver was gone. So all of these things were gone. And I was one point I was taking 5 different medications, and I was able to stop all of those medications. So that was a huge, huge change in my life. Within a few months, I could reverse a lot of things which have been bothering me for a long time. So that prompted me to start kind of helping out other folks. So then what happened was that I was working at the Cleveland Clinic functional medicine department. At that time, I was seeing all these clients who had very similar symptoms as mine. And one underlying factor was that all of them had Hashimoto's. So I instantly connected with them because I know what they were suffering from, what was going on with them. So I started researching about Hashimoto's and kind of knowing why these people are not getting better. Because they're doing all the things which the doctors are telling them to do, but still there was something lacking. So that's where I found the root cause approach. That's where I found the approach that I take with my Hashimoto's clients, applied it to several Hashimoto's clients, and they all got better. So that prompted me to write the book of Reversing Hashimoto's, my 3-step process to helping people. And that's what I do now, making personalized functional medicine plans to help people reverse their Hashimoto's.
Actually, refer to very interesting point about the medications, because I had asthma, right? Not from the childhood, since when I was like 28 or 29, I just realized I have asthma. And then the doctor, with all the specialists I went, they couldn't help me. The problem was not a specialist, different people, in because I went to good one. And then I realized there are something hidden behind these layers. It's not really logical to take a puff forever when you have asthma. Because why I didn't have it when I was like 8 year old? I didn't have any problem. I didn't have any asthma. Just one small accident prompted that asthma in me, and it was not genetic or anything. So I realized there should be something different, right? So, and even in fertility, when I talk to people, a lot of them have thyroid issue. Thyroid is one of main complaint, and when I ask them, it's not only thyroid, right? They have other issues connected to that. And when I talked to Heather, she said the same thing. She had pain all over the body. One day shoulder, one day back pain. You don't know where it comes from. You try to go different places and just go to the surface, relieve the pain, and then it comes back, right? The point is, we are trying to we are trying to find a solution for all of these pains. So we're going to talk about acupuncture. Acupuncture is my favorite. I love Chinese medicine and acupuncture, because the interesting point is, before functional medicine, I actually learned about acupuncture for my fertility issues. And then I see, wow, that's amazing, because they're not going to go through different medication. They just go through everything. Your liver, detoxification, digestion is not only one part of the body, is not only fertility. That's the problem with IVF and other medication. Before even going to root cause, to prepare your body for the better treatment, they just try to go little by little. That's why you stay there forever. That's why people just give up. They say, we're not going to have a baby. And then something happened and they have the baby, because their body is released. Their body want to have a baby. So I like to discuss about this with Cho. She also, she's been in my 2 books, Naturally Conceived, amazing information there. I love what she said about fertility. And this time she talked about autoimmunity because, to be honest, the root cause is the same. So that's why we're going to discuss about it.
Great. So I just want to say to Dr. Gupta, I'm really impressed. As a physician, I actually grew up in a medical household. My father was a MD and my mom was a RN. And so we had the medical journals, antibiotics, vaccines, surgery. It was like those were the ways that you fix things. And the fact that you experimented on yourself, because I'm a big believer in, before prescribing or recommending something to my patient, I'm going to find it out for myself, to kind of really know that, like, yes, I'm the first, if I'm telling you this is, I recommend it, I take it myself. I've taken it myself. So that I'm not just, feeding them a line. So really, like, overcoming your own health challenges and then recognizing it and then like helping other people with it is really a big deal, to go against the status quo or the standard, right? So I just wanted to mention that, and also, for figuring out. I feel like everyone is like had to go through their own journey of really figuring it out, and then you help people to give them a little bit of a shortcut once they can finally find you. So one of the things that I'll tie together with infertility and what we see with autoimmune conditions, whether they're pain, whether they're like emotional, like all of them, what they scream out is inflammation. And so we look at like that is a process that's happening. And in Chinese medicine, we're looking to really balance what we call the yin and yang. And so that means that something is out of balance, and then where to find it. For instance, if somebody, since they were 4 years old, was having digestive problems, that's really like the oldest thing that was in their chart. And then we're going to go, already that was like saying something that there was a process that was going on, and that's a clue, right? That's a clue. And so when I work with women who are trying to get pregnant, we're looking at all of those things. And so many women have subclinical thyroid issues, which endocrine and in Chinese medicine, we look at that as like kidney energy, their jing, their essence. And that's very deep. When you start to look at that affecting the system, it means it affects everything, right? So we can chase after lab tests and this and that, and we start to look at, okay, what's the like this is an inflammatory condition, and then we need to start eliminating things. Like first, of course, we're going to look at their diet, their stress levels. Diet is a really big thing, and we're speaking now, this is a Diabetes Awareness Month, right? Which should be like Diabetes Awareness Month, at least for 2/3 of the year, since about 2/3 of the population has, pre-diabetes or insulin-resistant conditions such as polycystic ovary syndrome. That is really, these are things that can also have been prevented and actually in some cases reversed if they really, do lifestyle changes. And the reason that I'm talking about the diabetes piece is that a lot of women, even when they do get pregnant, we're seeing more of things like gestational diabetes and, hypertension and other health conditions, which infertility is a window to the future, to like your future health. But the danger of when a woman is not healthy or has these conditions is also during gestation, that there are higher instances of things like autism, right? So they can link now not just things like paternal age, but also they're linking gestational diabetes to other kind of developmental problems for children that show up. And so really, we don't want to look at it just when we want to get pregnant. We really want to look at this like overall, like what's going on. And yes, the SAD diet, the standard American diet, which is like sugar, fat, a lot of animal products, processed foods, all contribute, maybe not directly, but as a but correlate. If you're eating this, then for sure you're most likely going to end up with these other problems, which then we're looking at, of course, the body is going to go out of balance and start having autoimmune conditions. And that creates a problem, like even if they can't read it, inflammation, if it's not diagnosed, is in and of itself the factor that is causing many health issues and for the body to respond that way. And so with acupuncture, it's, non-drug, stimulating the body's natural healing abilities, right? Shifting the neuropeptides in the brain and relieving inflammation, right? And more studies coming out of Harvard, they show that the acupuncture actually lowers that whole cytokine storm and intervenes. And so I think it's important that if people can start to take care of themselves, use things in a way, prevention, like to really like think about the long term, to think about a health span, right? Not just living long, but really healthy, and really invest in themselves and take care of themselves, become knowledgeable, make informed decisions, spend a little extra for the organic food, right? Do whatever you can and look at it as an investment in health. And also just listening to us, here we're talking, eventually, there's going to be benefit, and, there are many different ways. Yeah. And the book, we come out with like all of these, conditions really that medication does not stop the disease process, right? It could help with symptoms, but it really, taking charge of your health destiny is really about understanding your body and making those informed choices, right? So lifestyle, food, and then of course the assistance of, like-minded people who are looking at the person, not the disease.
So I just want to add something here. Dr. Anshul Gupta talked about the lab range. I really believe that lab range is very decisive because usually it's normal, you're right? But there is always something into it, because when I compare the lab range with the functional lab, optimal lab, you see the difference, right? And that's the point, because every time I talk to my clients and they say the labs were normal, and I said that's the problem. Look at I'm going to look at your lab, and I say, oh, they have blood pressure, they have lots of issues with the blood test, and that's when not everybody can talk about it, right? And unfortunately, that's with the medical, and we try to bring this awareness that please, please, please go to functional optimal range, not just the lab range. They are not the good standard for diagnosis and recognizing your problem. So let's talk about talk to Dr. Lauren Lax. So she has her story of this is the first time I have her in this panel and the show, so I love to hear more about her story.
So yeah, my journey starts back at age 10 years old. 10 years old on the fourth grade recess, and frizzy hair, pink bow that my mom made me wear, and all I wanted to do was fit in. And the popular girls invited me to join the gossip circle, where we're laughing at Melanie Strawn's ugly sweater and gawking over Eric Arthur's cute freckly face. And then the topic of weight comes up. And the queen bee says, oh my gosh, you guys, I weighed myself last night and I'm 69 pounds, so fat. And then just turning to each of us, what do you weigh? And one by one, we all had to go around the gossip circle and report to our drill sergeant. And at a healthy 80 pounds, I was by no means a fat kid. But when the circle got to me, I gulped and I lied. And I said, I don't know. And thinking, I just want to be good enough. And then going home that day, I'll never forget standing in the pantry and turning over my favorite Doritos snack pack and learning a brand new language, which was fat grams and calories. And at age 10, my life path took a sharp turn. And little did I know that I would spend the next 20 plus years of my life on a roller coaster of diets and dogmas and Dr. Google searches, looking for answers everywhere else outside myself to feeling good in my own skin. And during that time, I say I spent 4 years accumulated of my life behind bars, living in hospitals and treatment centers, where the typical treatment at that time, and still actually today, was Pop-Tarts, pizza, and Prozac. So treating the symptoms of my disordered eating, my funky relationship with food, with what made the most sense for food freedom and weight gain, processed foods, obviously, similar to our just take a pill for an ill philosophy with chronic and lifestyle-induced illnesses, or people that are just overweight, just move more and eat less. So my symptoms, I knew that model very well. And that journey continued on, and really the story began to come to a head when I was 23 years old. It was the day before my second year of grad school was about to start, and I was getting my doctorate in occupational therapy at that time. And I stepped on the scale at 5 a.m. only to see a number I had not seen since I was that 10-year-old girl. Only this time again, I was 23 years old. And for the first time in my journey to date, it scared me. And it was not my parents telling me what to do or doctors saying what to do. It was really like, this is my life, and is this what I want? And it really explained why I'd been having a lot of severe chest pains recently and why my stomach seemed to shut down every time I would eat anything. And I was subsisting off very little. And I'll never forget on my way to the gym, praying that morning, God, help me make a change today. And to me, that meant help me work out 30 minutes less on my Stairmaster or eat a tablespoon of almond butter more. And when I got to the gym that morning, not one, but 9 other individuals walked up. And these were 9 other gym goers who I now call my 9 YMCA angels. And they stepped in and they spoke up and said they wanted to help. And within 48 hours, I found myself in the ICU with a heart rate in the near 20s and doctors saying I may not make it. And just in that moment is when something clicked, because had those individuals not stepped up, I would not be here today. And what clicked for me is really the answer isn't out there, it's in here. And I didn't really know what that strategy looked like for getting out of that hole that I had buried myself in all those years. But I knew that on the other side, life was going to be different. And something in me knew I was going to make it through that night, which I did. And I would spend another year long in treatment, similar to the Pop-Tarts, pizza, Prozac model. But something inside me changed. And I said, you know what? I'm going to figure this out and figure out a new path. And after I got out of a treatment center in Miami, is where I stumbled into like paleo and CrossFit world, like just finding a new relationship with actually fitness instead of my Stairmaster, something that like I felt strong doing, no mirrors in the gym, community based was an olive branch into then finding a little bit more about ancestral health and then functional medicine. Chris Kresser was one of my mentors who is kind of a leader in the functional medicine movement. So I was introduced to functional medicine and really began just this healing journey with food and my relationship. Well, and little did I know that part 2 of my journey was about to begin. And after all those years of just chronic unwellness and just all sorts of diets under the sun, I ended up developing and being diagnosed over the course of 10 years with 10 different chronic illnesses that I had never had before. And these were all the autoimmunities, the mold, the Lyme that I mentioned, all sorts of hormone imbalances, osteoporosis in my 20s, and just like the list kind of seemed to go on, especially with the mast cell. If you're familiar with that at all, I was being diagnosed every 6 to 8 weeks with some sort of condition. Doctors didn't really know what was going on at that time. Now it's a little bit more on the map with like COVID, post-COVID era. We're seeing it a lot more. But all that to say is like I really had to become a sleuth, a health detective at figuring out what was going on. And I was thankful to kind of have this insider's access to a functional medicine like community, because I had started training in it inadvertently and started nutrition school during that time, got my master's in nutrition and functional medicine, and just was like studying as I was also healing. And so that really brought me to, I mean, just where I'm at today. So at like 33 years old, which was 10 years after that chronic eating disorder experience that happened, almost dying that night, it was really just like the catalyst year for then my health really turning a corner when I finally began to connect the gut and the brain connection as well. So that was like the final frontier in my healing journey, and learning about the limbic system, rewiring that, and learning German new medicine, which is something that I practice with my patients today as well, but to help them really take the lab testing out of what's going on, especially if it's been a very chronic issue for a long time, and really to understand what is our symptoms trying to tell us, the metaphors of symptomology and what's happened. So for example, gut issues, indigestible conflicts in our lives, something we can't digest, swallow, or eliminate, where we're feeling stuck. And or like skin issues could be like an attack conflict, something that my skin is my protective organ. So my skin may flare when I feel, whether it's in a relationship or a hard boss. The brain is mapped for over 1,000 different symptoms and conditions based on certain conflicts that we've had in our life. And so just really marrying the internal and the external is really what I'm doing today, and helping individuals really bust past the ceilings and that they're hitting in their health, or that doctor says there's no option.
Amazing. So, by this point, we talk about gut a lot. And I know gut is the very important part of the body, like the second brain or second heart, second brain. And we're going to talk about, after Dr. Miles, we're going to relate these topics together, why gut is so important. And we're going to talk about food sensitivity and why these are the real factors for Hashimoto's or autoimmunity disease. We go back to Dr. Miles. Please tell us your story. Did you have any health issue yourself, or you find out about functional medicine with your patients?
The moment when I was called into Valerie's office. Now, this was in school and I was struggling to get through. I was doing well grade-wise, but Valerie said, we have a strict attendance policy, and if you're not there for your morning class on time, it's going to threaten your education. And I said, well, I'm trying. I'm doing my best. I get enough sleep. I do a lot with my diet. I do a lot with going to sleep early. I'll sleep 8 hours, 9 hours, 10 hours, 11, sometimes feel even more tired. And it takes me a while to get going, and it doesn't seem to matter. I've gone to the doctor. They said everything looks normal on my blood tests, and I haven't been able to, I've gone to several other practitioners. No one's been able to figure this out. I don't know what's going on. And she said, well, I think you need to investigate further and figure it out. It sounds like a medical issue. And I said, yeah, I agree, but I've been trying. And I was so chronically fatigued that it risked my education. And it was difficult for me to come to terms with that, because I thought back to my father, who was a doctor and had a master's in public health and was a politician and had done amazing work in the world. And I knew in myself the potential to achieve was so high. But I also knew that I remembered back to the day I was babysitting for a friend's, my sister's friend. I was 15 years old. And the phone rang, one of those old style, like yellow phones on the wall with the cord that reminded me of my grandmother. And I answered the phone, and it was someone from my church. And she said that something's happened. Your father's in the hospital and you're going to have to come immediately. And I found out that my father died suddenly and unexpectedly from a heart attack. And going back to that and having experienced chronic fatigue for myself, I started to question, do I have what it takes? Like my father did this, but then he passed on early and I'm struggling to even get through, and doctors say things are normal. What's going on here? So it took me a long time, actually. I was able to get enough through a sleep specialist to get excused to make my way through school by a diagnosis that was not helpful for my energy, but it was helpful for the school to be working together with me to make it work. And I was able to do well and move into deciding that I needed to figure this out. Like Dr. Lauren, I looked internal and external. I really looked at meditation and mindfulness practice. And I also looked at functional medicine, and I discovered functional medicine in part because I wanted to figure things out. And as you were mentioning these lab ranges, I realized that the doctor that had said that my blood work looked normal, that my TSH, my thyroid stimulating hormone, actually was above 4, which is normal according to reference ranges, but not optimal by any means. And when I realized that, I started to look at research. What's correlated with thyroid issues? I did realize a lot of thyroid is autoimmune and has this Hashimoto's component. And so then I realized and read some research papers showing H. pylori in the gut and some gut dysfunction and small intestinal bacterial overgrowth can be related. And I tested myself for H. pylori. I actually tested twice. The first one came up negative, the second one positive. And I found H. pylori. I treated that. I felt a little better, but not completely. And then I found parietal cell antibodies are positive for 20 to 40% of people with thyroid issues. So I tested that and I found I had these antibodies to these cells in my stomach that make stomach acid. Stomach acid is really important for metabolizing nutrients and protein. And I realized also that it makes intrinsic factor, which it's important for vitamin B12, which is important for energy. And then I felt better with treating that and doing B12 injections, but then I still wasn't feeling completely better. And I found infections, and I was living in mold, and I found Babesia and Bartonella, and it took me a long time to wrap this all together. There was just a lot going on. And as I've unraveled the layers, it's been feeling a little better, and I had to address internally and externally both and figure out some of these root causes underlying. And now what I've realized and recognized through this process is that I wish that others didn't have to go through such a long journey. I think a lot of us share here a long journey to try to figure this out. And that's why I've been inspired to put together the clinic that I have, is because I want to help people have a step-by-step process to figure out root causes externally, and then to also look internally at practices that can be helpful. And many times I find that with fibromyalgia, with chronic pain, that we see that there is an infection-based root cause. And we do see that a chronic infection and or a gut issue and or a toxin accumulation and or a methylation issue or a cellular issue are all playing together. And it's usually a perfect storm. For me, I realize as I look back at my life, oh, I had asthma and eczema as a kid. It took me a while to tie that in. And oh, there was exposure to smoke because my dad's mom was living in the house. She couldn't go outside. She was so sick and she was smoking. And then there was mold, I realized later. And then just a couple of years ago, I found out there were ticks in the dog yard that had been, they said, don't have a dog for a couple of years because there's a tick problem there. And all these things start for me to realize, oh, there's this allostatic load. The body has a tremendous capacity to handle a lot, but you combine, I had these traumas. I had my dad pass on. I had adverse childhood experiences. I had asthma allergies. I had toxin exposure. I had smoke exposure, mold exposure, tick-borne infections. And it took a while for them to come to a head. But then adding the stress of school and some other things in, then I was almost unable to meet my dreams. And that's really something that I don't want for other people, to not be able to meet their dreams or to have happen to their family what happened to my family when my father passed on. So I've become very passionate about helping to figure out what are these root causes and how to predictive and preventively focus on longevity for high performers like my father, who I'd like to be able to do more in the world, do more good work, and follow passion and purpose.
I'm going to give you an example. My daughter is 4.5 years old. She had some food sensitivity, I know. And whenever the first time she was like 7 months old, and she had fly bites, and I could see the rash all over the body, right? And then sometimes it happens, sometimes she has this problem. I went to different specialists. Unfortunately, the dermatologist said, I cannot see these rashes. The problem is, as soon as you go to pediatrician, then they send you to another specialist. It takes like 2 months for an appointment, and the rashes are not there anymore. And she said, I can't diagnose this because I can't see any rashes, right? And then you go to food sensitive, to go to allergies. Unfortunately, they don't do functional labs. They have their own labs that is not really um, they are not really optimized to find your problem. And I said, can I have this MRT or food sensitivity? And they said no, because she doesn't need it. And whenever she has rashes, we give her some cream. And this is so sad when you go somewhere and from different specialists and you hear these answers. Then you know, with some small test you can understand that what's the problem, right? Or you go to acupuncture to understand exactly what's the issue. So even for myself, inflammation, as Cho said, for me was the reason why I couldn't get conceived, or I had some fertility issues. As soon as I found out what food is not good for me, what is it my red zone, what is it in yellow zone or green zone, then I had more awareness about my own body. Unfortunately, here they don't do this test for free. And because here we have OHIP in Canada, and this test is not covered, and that's why they don't do it. And when I asked the asthma specialist, I said, what's the problem? Why don't you do the allergy test or food sensitivity test on my body? And they said, you have lung issue, and with the puff, everything is good. This is not, you cannot use this forever. You have to find it in your body. Maybe you have mold issue, as Dr. Anshul said, right? So let's go back to different part of it, because we're going to go discuss in a broader range. Let's talk about food sensitivity with Heather and Dr. Lauren, because they had the same issue. Very brief, and then we're gonna go to acupuncture, how she look at this problem. Because as soon as you have you're bloated and you think that is normal, is not. And it's not you to just take the Tums all the time. That's what I did before. After I found out about my inflammation and then trying to avoid those food which were not good for me, everything gone, right? So let's go back to Heather and talk about inflammation and food sensitivity with her.
Absolutely. I love Dr. Tom O'Brien. He talks all the time. We hear this gut is the second brain, and he actually says, I think it's more like the first brain, because they're starting to find out that with every signal the brain sends to the gut is sending about 6 to 8 signals back. Right. So if you've got an issue in your gut, if you've got a dysbiosis going on with your gut flora and your microbiome, nothing is going to work right, because all the signals are going to be off. You're going to have stuff getting into your bloodstream that doesn't belong there, which causes an immune reaction, right? Which is just havoc, So food sensitivities, it kind of irks me when I hear other practitioners kind of downplay the role in people's health journeys, because really it's like low-hanging fruit. I mean, within the first month after I did my first food sensitivity test and followed the program, I had lost like 30 pounds. I was sleeping at night. My pain went from like a level 7 every day to about a level 4. Like ridiculous, amazing things happen in a very short period of time by just removing inflammation off the body. Every little brick of inflammation you can move off the body, whether it's from food sensitivities or toxins or mold or, trauma, again allows the body then to take over and do what it knows how to do very, very well, right? It's a beautiful thing on how well we're designed, and how much burden we can take before, it actually breaks. So yeah, food sensitivities are absolute. I love doing food sensitivity testing for folks, and then getting in there and really healing the gut and getting that inflammation down.
Actually, food is one of the stressors. You go to doctor, they say you have food sense, you have some stress, right? You don't know what this stress comes from, but from the functional medicine point, the stress can be like five, right? Five factors, five hidden factors that you don't know about yourself. Let's talk about them. um, First, we're gonna go to endocrine issues. Dr. Anshul are gonna talk about this as well. And after food sensitivity, we're gonna talk about we're gonna talk about it with Lauren and Cho, and then we're gonna go back to Anshul. Lauren, I know you had some gut problem. How did you uh, start uh, treating it? What was your solution?
Great question. I mean, I think it's always good to get a good foundation and understanding what is going on under the hood. And so I did do some testing, like stool testing. I did SIBO testing, small intestinal bacterial overgrowth, to just kind of get a little peek at the terrain. And we don't put all the cards in one basket for testing, but it can be helpful for looking at patterns. So if one has dysbiosis, like bacteria imbalance, I would say it's pretty safe to say if you live in the Western world, you've never minded your gut health or done anything towards it, there is going to be some sort of gut dysbiosis or just needing to mind the gut in some degree, whether it's been, I was on years of antibiotics as I was, or years of processed foods, years of dieting, chronic fasting, not eating for a long time will also wreck the terrain. And so just getting a really good understanding of what was going on and under the hood. And then, I mean, using food as medicine is definitely an approach. So we've talked some about just like how food sensitivity can be a piece of the puzzle. And I think I tend to also work on the other end of the spectrum where folks have like completely just been eliminating a lot of foods for a long time. And so they may be eating only 5 to 10 foods because it's all their body can handle. And so then a big piece of the puzzle becomes like rebuilding the terrain and metabolic flexibility, the ability to tolerate a variety of different foods, and slowly increasing introduction and bringing more foods and variety from a real food perspective. So if it didn't grow on the land, swim in the sea, or roam the earth, it's not real food. Within context, there's things that we can find in a grocery store aisle nowadays in a jar, like say a jar of almond butter, for example. But that would be a good rule of thumb from a food perspective. So, but from a gut perspective, that's what I did, is understanding what was going on in the gut, and then to really begin to make have more of a towards versus away mindset with food. So what can I have versus what can't I have, and how can I increase diversity and variety in my gut, rebuild my gut bug army with food and variety there, and slowly increasing that. And the way that we can prepared food, or like that, made a huge difference in my gut.
Exactly.
Well,
Preparing the food, how we're gonna talk about it right now. Let's say up to now we talk about gut, and this is important. Customized diet, right? We need a customized diet because one diet for you may not work for another one. So that's why I don't like typical diet for everyone. Your body may be sensitive to something that others not. Like myself, tomato and mango are in yellow zone, so I don't eat it that much because it give me inflammation. Before, I forced myself to have tomato because I thought it's good for me. So try to find your customized diet. That's what we do as functional medicine practitioner. With Cho as well, she actually believe in inflammation food. I believe in it, and she has a detoxification process, which I love as well. Do you start from gut, or what's your style?
So, when people are really sick, they can easily get overwhelmed, right? They got to cook their food, they got to, and so one of the rules of thumb, which I say, is the more complicated, the simpler we're going to look at. So we're not sending too many messages. So I will recommend just cut out dairy, like the dairy, processed foods, including ones that are quote unquote healthy, like, protein bars or anything that's really processed, sugar, a lot of wheat products, like wheat, because it's all genetically modified, and then do a couple of substitutions, right? So, for instance, I actually posted it on my Instagram, is really like, Chinese broccoli. You can eat regular broccoli, but instead maybe substitute something that has higher nutritional value, right? And so Chinese broccoli is like has the most calcium of any food. It's like one of the top calcium foods, including folate has in there, vitamin A, all these other things. So if you're going to eat, it's really also, when you're picking and choosing, to really be educated about it, make simple changes. Yeah. So for the gut, a lot of people say like, I say you need to do a probiotic. You got to have something, at least 8 to 10 different strains, and at least like 50 billion to repopulate. Because at this point, just about everyone has taken an antibiotic or something that's basically created an imbalance. And that could have happened when they were a child. When they had a little, sinus infection, they were given some kind of amoxicillin, and then that slowly set them up for later on to have all of these imbalances. So really, again, like looking at the long term. So when someone says, I eat a lot of yogurt, I'm like, yogurt is not a great, dairy is not a great thing for the body, and also not the best source. Right? Maybe have some fermented food, or even, like pickled vegetables, use them as like a garnish, but really like simple things to heal the gut. And also, again, with fertility and women getting pregnant, one of the challenges is if the woman has a history of an eating disorder, that started talking about restriction can kick that process in. So I really like to look at like everything. And in some cases, they're not having enough protein, very challenging when someone is vegan, to, help them regulate, because they just may not have enough nutrient dense foods. And of course, even if they're not breaking it down and absorbing it, then, all of the nutritious food in the world is not going to get absorbed and processed. And so, Chinese medicine, or in food, we look at the eating in season. It's very traditional. And anyone who comes from an older culture, more ancient culture, you have certain foods that you eat during season because they're in season and they're nutrient dense. And so this would be like a guideline, for someone to say you eat more of what's in season, because you're going to get the better quality versus having something flown in from, somewhere else in the world. So these are like a few things that we're looking at. And then also, what was I going to say about the food sourcing? When they're eating as well. So when people eat like irregularly, that also causes a lot of problems. Being able to, in Chinese medicine and in the cuisine, I was going to say is we always see something like ginger and garlic as a base. Right? Because number one, we're looking at the ginger warming the stomach. Garlic and other spices traditionally help to get rid of parasites and worms and things like that. And so really looking at what's the wisdom coming out of, different cultures that use things like turmeric, right? That is very traditional in the Near East. like certain spices that actually help with digestion and also help to prevent parasites and kill other microbes like that we don't need. And so we can take from like those kinds of foods and really apply it. So you're eating things that you like, and also you recognize that they're healthy. In herbal medicine, we always see there are two things that are usually always there, always, and that is ginger and licorice. So again, the ginger to warm the stomach and to get the juices flowing, and then the licorice is to help coat the digestive tract, especially if there are going to be some herbs that might be a little bit difficult to digest. And so taking those principles into eating eating food is we're looking at, okay, you want to eat vegetables. I'm not a big fan of raw. It's hard for people to digest, right? And so you want to blanch a little bit. There's a lot with food theory in Chinese medicine. Like food is one of the 8 branches of Chinese medicine. And so when I have a patient, I want to help them make a few different little changes. Let's just put it that way. Add things, take a few things out, but really simple. And again, as you know, when someone has been searching and getting all kinds of information, give them something very, I don't say easy, but clear for them to do, that they can do it. And then they'll have success with it. And then they're going to be motivated to continue, right? Instead of like chasing after other things, right? So really they'll feel more in control of their body. And that's the first, so that they know they're their own doctor, right? And I like to say the healer that you seek is already inside you, right? And that's the, tapping into that innate healing ability.
I was going to ask you for one sentence later, but you already said.
I already said it, yeah.
Yeah. So that's the last discussion about the endocrine system, because we talk about Hashimoto, which is related to thyroid. But as you know, all of our hormones are really related. So one blood test is not really enough to understand about your hormones, because as you know, it doesn't go through all of them. What we do in functional medicine, we do the saliva test, so it goes to cortisol, DHEA, and other hormones in the body, 6 hormones. And so is not enough. You just go to thyroid and say, oh, okay, you have thyroid issues, right? So let's talk about this we have 5-10 minutes to go with Anshul and Dr. Miles. We're gonna start with Dr. Anshul.
Absolutely. So Hashimoto's disease and thyroid conditions are often misdiagnosed, because the traditional way of checking for them is just doing this simple test of TSH. But the TSH is actually not diagnostic of all the thyroid conditions. So often people need much more in-depth analysis of their complete thyroid profile. And plus with Hashimoto's, you have to do these antibodies tests. Several people have been suffering from thyroid disorders for several years and they have no idea whether they have Hashimoto's or not. While currently around 90% of all the thyroid conditions are actually because of Hashimoto's. So it's very important for people to get a complete diagnosis so that they can take proper steps. So like not only with TSH, but the complete thyroid profile will include a free T4, free T3, and if possible, also a reverse T3. But for Hashimoto's, you have to ask to get antibody levels checked. The 2 antibodies being the TPO, which is the thyroid peroxidase antibodies, and thyroglobulin antibodies. So this is the complete testing that each and every person who has been diagnosed with thyroid profile needs to get done. Now, the reason that the traditional doctors are not ordering the complete profile, especially not checking for Hashimoto's, is that in conventional medicine, there is no treatment available for Hashimoto's. The only treatment available is thyroid hormone, and it doesn't really matter whether you have Hashimoto's or any other disease, they can only offer you that. But in reality, this thyroid hormone or levothyroxine is not doing anything for the underlying autoimmunity, which is core reason of Hashimoto's. So it is very important to know whether you have Hashimoto's or not, so that you can actually start working on this autoimmune process. And that way you can safeguard your thyroid gland. Because in Hashimoto's patients, they get started on a very low dose of the medicine, but slowly and slowly, as more and more thyroid is being destroyed, the dosage of that medicine keeps on increasing to the point that one day their thyroid is completely destroyed. And then they have no choice except for relying on the medicines. And the worst part is that even after taking medicines, several people continue to suffer from symptoms. So, medicine is actually not even helping to get people better in terms of the symptoms. So, that's the whole difficult and unfortunate situation with Hashimoto's that we are dealing with. Nobody's listening to their patients. Patients
Exactly.
keeps on telling them about different symptoms, but obviously practitioners are not listening. So very important to vouch for your own health and get proper diagnosis, proper testing done, so you can reach the right profession and do things to help you to feel better.
As you said, even Heather has had Hashimoto's, but that was not her own, the only issues, right? She had celiac and Lyme, right? So as you see, you may try to treat the paper. As you see on the paper, you have thyroid issues, but you may have on the other underlying issues, which is related to Hashimoto. So we're gonna continue with Dr. Miles. What was your own experience about endocrine problem? And God, yeah.
Yeah, and I do a similar panel to Dr. Anshul in looking at more comprehensive thyroid markers because, again, I had TSH that was high normal, but when I looked a little deeper, I found more going on. And then when I researched why, because it isn't enough to know that there's autoimmunity. And even with antibodies normal, sometimes they ultrasound the thyroid and they see it's being attacked, which is really interesting because sometimes there's autoimmunity even without antibodies. But of course, if we see antibodies, we know for sure there's autoimmunity. But then we have to ask, why is the immune system attacking self? And that becomes interesting. There's, for me, I looked at, because I saw a paper that said, oh, if you treat H. pylori, thyroid antibody levels go down. And I thought, that's weird. Where with bacteria in the stomach, if you treat that, the thyroid antibody levels go down. It took a minute to try to reconcile why is that. But I did find H. pylori and I treated it and I felt better. And then I realized that H. pylori and thyroid issues are connected with parietal cell antibodies. And about 20 to 40% of people who are struggling with Hashimoto's, there are antibodies against parietal cells or sometimes intrinsic factor. And then that leads to the low stomach acid production and low B12 absorption. And that leads to further worsening energy. My chronic fatigue had a lot to do with B12 insufficiency in addition to thyroid directly. But then we have to ask, well, okay, so if it can be this gut issue, like H. pylori or small intestinal bacterial overgrowth, what else can it be? And we see, I see research, there was a paper that came out that showed Lyme, the bacteria Borrelia burgdorferi that causes Lyme, has a section of the protein structure that looks almost exactly the same as a section of the thyroid protein. So now it's becoming apparent that certain infections, Borrelia burgdorferi or Lyme disease being one, Epstein-Barr virus, which causes mono, being another, and several other viral infections can have what's called a cross-reactivity, meaning they look enough like thyroid tissue that if the levels of this bacteria or virus are elevated, the immune system's trying to get rid of the bacteria or virus, but in those who are genetically predisposed to Hashimoto's, there can be a cross-reactivity. Now, the immune system inadvertently is attacking the thyroid because it looks a lot like some of the protein structure of the pathogen. So now we get systemic infections and pathogens creating a cross-reactive autoimmunity and the immune system attacking thyroid when it's trying to deal with infection. As the infection load lowers, if we are able to identify and treat infection, that calms the immune response also. And we can see lowering in thyroid antibody levels from that as well. So often there's an infectious component, a gut component, could be H. pylori or small intestinal bacterial overgrowth, and it could be that there's intestinal permeability for a variety of reasons. There's leaky gut, and big proteins from foods now are making their way into the bloodstream. And now the immune system looks at the food and says that's a problem. And we see cross-reactivity between latex and thyroid tissue, between tuna and thyroid tissue. So we're starting to see some food proteins might actually start to create this cross-reactive autoimmunity too when there's leaky gut. And then we have to ask, why is there leaky gut? And this gets a little complicated fairly quickly. But if we can look at the gut and we can look at it in a comprehensive manner, as Dr. Lauren was talking about, and we can look at food sensitivities, as we were also talking about, and we can look at infections. Now, I didn't mention toxins. Those are in there too. Certain toxins can cross-react, and they're endocrine disrupting toxins. And my mind was blown when I read a paper that showed that there's average person can have up to 5 grams of microplastics in their urine per week. That's equivalent to about a credit card worth of plastic per week in the urine as microplastics. And we know plastics have endocrine disrupting chemicals in them that can dysregulate the whole hormone structure, including thyroid hormone. And when you take all this into account, it's no wonder that a lot of people are struggling with autoimmunity today. And there are things that can be done if we take a holistic approach and we look at toxin, we look at infection, we look at gut dysfunction, we look at food sensitivity, and we take that full picture and we work on that. Now we're really seeing thyroid antibodies dropping and people starting to feel a lot better.
I like that, because that's the whole purpose of this talk. Please, like, I'm not saying if you start from one specialist to another one, you waste your time, right? So start from the holistic approach to go through all over the body. You may find lots of miracles in your body and how it can do with you. Just not trying to treat the paper. That's what I'm saying. And then you see all of these parts are really connected to each other. That's the whole purpose of this talk. Right now, we're going to end the talk only with one sentence from each of you to give some hope to others who have the same problems that we had with the chronic pain, and how you can give some hope to them. Okay, starting with Heather.
Even if you're working with a functional practitioner, if you've got somebody who's not talking to you about diet, stress, lifestyle type stuff, and they're just wanting to, exchange a prescription for an herb or a supplement, run. I'd go find another practitioner, because if they're not taking that holistic view that we've been talking about this whole thing, then you're just trading, one pill in for another kind of pill. So, but don't give up. Keep digging. There's hope out there. You just got to keep looking.
Okay, I'm gonna go to Cho, because I don't want to lose this point. She said in her book as well, she said, run away if somebody tell you have to take this forever. Can you repeat this, right? What you said in the book?
Oh, yeah, sure. Well, there are always like a few things. One, when with my patients, that they say, well, maybe there was in my book where in one of my first fertility patients, the doctor was like, said to her after several times, like, well, maybe you're just not meant to, have a baby. And I said, well, if there is a God, that doctor is not it. And so what I would say is, whoever is searching, that sometimes you may have to go through several different people, even so maybe one functional medicine person that's not all of functional medicine, or one acupuncturist, Chinese medicine practitioner. That doesn't mean they're all the same way. Really important is that no matter what you tell them, that they are listening. And that's like the beauty in Chinese medicine, is like all the weird things like dreams and strange, what we would consider strange conditions, that's information. And all of that is important to put together this, complex puzzle piece, to be able to offer you things for you to do. And, as with Heather, if someone's just going to say, oh, I just give you a pill for it, and are not also educating you as part of the process and helping you to understand what's going on so that you are more connected with your body and can actually give feedback, then that's most likely not a good fit. Or if they say you're going to be on this medication for the rest of your life, that's a sign like,
no, that's not it.
that's definitely not it. That's
Yeah.
not it.
Okay, Dr. Miles.
So I really have seen some things that border on miraculous, that people recover from things that have been going on for 20, 30, 40 years. I had a patient, she had fibromyalgia, severe chronic pain. She was on oxycodone for that, and she had 4 other medications for the depression that came with that, for anxiety. And she had such bad endometriosis. She was in her 20s getting Lupron injections to induce basically menopause early because it was so bad, her cycles. And with 6 months of doing some elimination and reintroduction on the diet, discovering that there was mold toxin and reversing that and getting that out, and discovering there was a chronic infection, working with that, and looking at the gut and seeing gut issues and working with those. In the 6 months, she went off all 5 medications, had no pain anymore. And so there's a lot of hope. And medical interventions are increasing dramatically. Some of these cutting edge therapies, it's not a pill for an ill, but it's a comprehensive approach of being able to look at a paradigm of many different areas. And we see things like peptides starting to signal repair to damage that was done by autoimmunity and damage that was done to the brain by toxin exposure. We see fMRI imaging of the brain and areas that were damaged, growing gray matter back again. I mean, there's a lot of hope for people. And if you're not feeling like you're getting results, don't give up, keep going, keep finding something. I almost gave up, and I'm so glad that I didn't. And I encourage everyone, keep looking.
Thank you so much. I love this talk and this summit because that's the real life story. That's the personal history of what happened to us. And we are sharing with you. Hopefully, you don't have this chronic pain and take the pills forever. This is not normal. So let's hear another hopeful sentence from Dr. Anshul Gupta.
Tell you. So I just want to share that don't let anybody tell you that you have to live this life the way it is right now. There is hope for you to get better. If you're not feeling better, then there is certainly a root cause that you have not yet identified. So keep looking for that root cause. Once you address that root cause, you are going to feel better. Sometimes there are multiple root causes. So don't feel that you found one, so there are not others. So keep looking and you will find your reason.
Okay, and Dr. Lauren,
Great. Yeah, I would just say when given the right tools, your body innately wants to heal itself. It's wired to heal. So it's like if you break a bone, slap a cast on it, what happens in 6 to 8 weeks? It naturally heals. Even if a person's eating McDonald's every day, and I'm not a huge fan of McDonald's, but it's just like your body has that innate wiring in it. So just knowing that and just making up the decision, deciding that life is and can be different on the other side, seeing yourself as being well, and that can start today. And then just the getting there, just as long as you have that vision and know that, you're going to get there. And so I would say looking towards versus away too.
thank you so much for everybody participating in this summit. Actually, the Needs Gap, it's available on Amazon. Right now, we hit #1 bestselling in Canada and US. Please get this book, read it. Hopefully, you can get a lot of information there and you can find the root cause of your issue. Heather Gray and Choling Moy are two authors of this book as well. First of all, congratulations for you guys being in this book and get the bestseller in this. And the promotion gonna be continued until November 17. We're gonna continue this talk tomorrow with another 5 amazing speakers there. So be with us tomorrow as well. And if you have any question or anything that you're going to share with us, or you want to find any solution, please go. There are some, go and enroll in this website, acechoice.com, idea.com, acechoiceidea.com funnel needs gap. You can find the amazing freebies there and all the links to the books that we all have. So hopefully see you tomorrow, and hope we thrive for health. We advise holistic medicine, and we really, really wish your problem can be healed so soon, very soon.